right, I don't want you guys to have a Kanak attack. So everybody, this is your chance to do a big yawn, go, ah. Really? Okay, all right, so you're not gonna fall asleep. All right, well, you guys are doing really good. We have two really good speakers. Today's Summer Mochida Meek from Project Echo and Dan Lyon from the Executive Director of the Hawaii State Rural Health Association will be coming up. He was originally gonna talk to lunch, but he will be speaking with Summer. The ECHO model is a form of teleeducation that has evolved into a learning framework that applies across disciplines for sustainable and profound change. Learn how we can reach many pockets of a rural state through ECHO and bring important educational opportunities and discussions to them. Summer Mochida Meek, MPH, is committed to improving health accessibility and mitigating health and social inequities amongst Hawaii's rural and minority communities. She serves as Hawaii State Rural Association's project coordinator of Project ECHO's pediatric and behavioral health clinics. Let's give them a round of applause. Thank you so much.
Aloha kako. I'm really praying that, last time I was in Kaua'i, I was here, had brought a football team from Hawaii campus of Kamehameha schools, and we kind of got bussed up, so I'm hoping that I have a little better reception today. I got asked just to spend a few moments on speaking about who the Hawaii State Rural Health Association is and what we do. And so I just wanted to take a few moments to do that, and then we'll have Summer come up, and she will talk about Project ECHO. I will tell you, I'm very new to the association. I'm the first executive director that they've had. They've been in existence since 1998 as a volunteer board, working mostly in advocacy and policy change. And so, I started in January of 2023, and I feel like the board just felt like they had expanded their bandwidth. They just couldn't go any further. They needed an executive director, and I've been in trying to kind of get things in order and do things like that. So I am very new to it, and so in trying to describe what the Hawaii State Rural Health Association is, I'd have to say I would use two words, and one is collaboration, and the other one is decolonization. And I say decolonization. The last job, I spent 20 years of hard labor at Kamehameha schools, and then I went and worked at Bishop Museum, and I was the director of foundation relations there. And one of the real big projects that I had was working on decolonization, working on the aspect of looking through things through indigenous perspective. And so that really affected me as I looked at it. I have my wife and my children all graduated from Kamehameha schools. My grandchildren, I have 10 grandchildren, they're all in immersion schools. We've been very involved in the Hawaiian culture, and it's really impacted me to see this to the extent that colonization has destroyed a people and their culture, and how looking at things through this Western perspective really destroys how someone feels about themselves. And so it's really an amazing experience to work in that and to be researching and writing in that regard. And then when I came to the Hawaii State Rural Health Association, we sponsored a roundtable, it's called a listening session with federal partners regarding the reimbursement rates of Medicare. And, Hawaii actually gets paid less in Medicare than Kentucky. And so we brought up and the University of Hawaii had some really amazing data about the cost of living in Hawaii and the cost of doing business in Hawaii, and trying to look at why that Medicare reimbursement rate was so low. And the people from CMS answered that question in a way that it really angered me, because they said that they didn't agree that the cost of living and the cost of doing care in Hawaii was as bad as what we were saying it was. And I immediately thought to myself as far as colonization. That's all it is. It's the same colonization with a different face to it, but we're going to look at something from some other perspective and not know what it's like to live here, not know the fact that what has happened, the atrocities that happened to the Hawaiian people and to indigenous people in Hawaii, how that has affected all of the rural areas and the indigenous people and the people that live here. And you come and visit Hawaii, and it's a beautiful place, and you stay in a beautiful hotel, and everything is really cool. But if over 60% of our homeless population or houseless population are part Hawaiian or Pacific Islander, to me, there's a reason for that. You took their land away, and so. But if you don't get in the community, and if you don't understand that story, and there's so many people that don't understand this story of Hawaii, and I personally believe that what the United States did, and I'm sorry, I'm making this political, but I really feel it has an effect on healthcare. We're not going to fix the health problems of our people, of mental health, of any of the health issues, any issue that's out there. We're not going to fix it until we recognize the problem that we created. And we start to work on that and to fix it. And I believe that the greatest atrocity the United States has ever done was to illegally overthrow a government and then not do any reparations. In fact, not even really recognize it. I've heard two presidents that come here, and I've heard them say out of their mouth how terrible it was, but there's not been any action to it. And so for me to sit there and listen to somebody from Medicare and say, well, it's really doesn't cost that much to ship things to Hawaii. You could do more collective purchasing. They had all these solutions to how we could lower the cost. And I don't believe there's any healthcare providers that aren't trying to find ways to lower costs and to be able to survive. But we also know that we have a terrible problem. We have a problem with being able to keep health providers. We have shortages, and we have real problems in rural areas. And so that really was my motivation for coming from Bishop Museum and coming to the Hawaii State Rural Health Association, was because I think it's just a powerful way to make a difference. And what we try to do is we try to work in the area of collaboration. We're not going to come in and try to copy something that's being done in a community or go compete against something that's being done in the community. We're trying to go and see how we can work collaboratively with you and help you to accomplish the things that you're trying to accomplish. In 2023, we will give away almost $1 million to healthcare providers who are trying to expand services to rural areas. That's nothing that we're doing other than rounding up the money to give to people who want to expand services. We have given almost $100,000 to organizations to do efforts like this, to support efforts in the communities in that way. We do things like ECHO that's educational throughout the community. We do a lot of things, we support the Molokai Kupuna project that services almost 1,000 kupuna in Molokai. And we support that administratively, and we support that through but it's not us doing the work. It's us supporting the efforts to do that. And that's really what we see as our goal, is advocacy in the community, politically and with policy change, with working in the community, with learning about, what communities need. Each rural community, there's not one thing that will fix all of it. Each one is different, and you have to be able to communicate and develop those relationships. And that's really what we're trying to do. And so, again, if I were going to say what the Hawaii State Rural Health Association, it is those two things. It is working in collaboration of trying to support the efforts that people are doing on the ground, and trying to work with federal partners and state partners of changing the way that things are being done, and to be able to look at things through what I would say an indigenous, but it's from a local, from a rural perspective. And then the other aspect is just to not try to solve things through that sense of colonization, of understanding that we have to really meet the needs of people in order to make a difference. And so that's really what I had to say, and I'm going to turn it over to Summer, and she will share about ECHO. So thank you very much.
Aloha, you guys are still here. Okay. Aloha everyone, and mahalo to the Kaua'i Rural Health Association, the Pono o Kaua'i conference team, and again for all of you guys for sticking it out. You guys are almost through the day one. Thanks for this opportunity to share on behalf of Hawaii State Rural Health Association on our Project ECHO. I'll try and be real quick. I know we're kind of running out of time here. Project ECHO, or Extension for Community Health Outcomes, is about moving knowledge and not people. Here we have Dr. Sanjeev Arora. In 2003, Dr. Sanjeev created Project ECHO to meet the needs of New Mexicans who lacked available and accessible health care. Dr. Sanjeev's mission began when a 43-year-old mother of two walked into his New Mexico clinic too late to travel all the way to Albuquerque to make the 4-hour-plus trip for the specialty care she required, and she soon died from a very treatable disease. It was then he set off to create Project ECHO to deliver specialized medical knowledge to rural health care providers like yourselves. The ECHO mission is to make knowledge accessible at the right time, empowering people to make a difference in their communities with the right knowledge at the right place, and of course at the right time. So what is ECHO? Every year, millions of people around the world die of diseases that are preventable, treatable, and even curable because healthcare providers in their communities do not have the knowledge and expertise needed to address their concerns. Project ECHO offers a low-cost, scalable solution that increases the capacity of healthcare workers in under-resourced communities like ours to provide best practice care and education to our communities. Project ECHO builds communities of practice through free virtual mentoring and learning. And through ECHO, professionals learn and share best practices in healthcare, education, and growing to more areas. ECHO connects hundreds of partners worldwide, governments, academic medical centers, and non-governmental organizations, enables them to train and mentor hundreds of thousands of healthcare providers in virtual communities of practice where we believe that all teach and all learn.
Project ECHO is a performance optimizer. Think of it as a high-speed internet connection for the healthcare system. It spreads new medical knowledge throughout the healthcare system, from university medical centers and other specialty care sites to the front lines of community care. Rather than information flowing in one direction, community providers learn from specialists. They learn from each other, and specialists learn from community providers as new best practices emerge. Under ECHO, community providers use video technology to participate in guided practice with specialist mentors. They acquire new skills that allow them to treat patients they otherwise would have referred out. Patients with complex chronic conditions get high-quality care where they live from providers they know. No waiting months to see a specialist. No long drives back and forth to get critical care. ECHO exponentially increases access to specialty care by moving knowledge instead of moving patients. Suffering and pain are reduced, and lives are improved and even saved. Project ECHO, changing the world fast.
We can just go to the next slide when it goes, but inspired by the way clinicians learned from medical rounds during their residencies, the ECHO model has evolved into a learning framework that applies across disciplines for sustainable and profound change. ECHO participants engage in a virtual community with their peers where they share support, guidance, and feedback. As a result, our collective understanding of how to disseminate and implement best practices across diverse disciplines continuously improve and expands. During an ECHO session, participants present real cases to the specialists and amongst each other for discussion and recommendations. Participants learn from one another, and as knowledge is tested and refined through a localized lens. This continuous loop of learning, mentoring, and peer support is what makes ECHO unique, with a long-lasting impact far beyond that of a webinar, an e-learning course, or telemedicine care. The ECHO knowledge sharing model brings together specialists from multiple focus areas for a robust, holistic approach. It's important to distinguish, though, that Project ECHO is different from telemedicine. In most telehealth models, specialists from academic health centers personally manage patients and provide direct care, maybe using video teleconference technology as well. However, Project ECHO uses an indirect care model and the co-management of patients. Specialists support and collaborate with PCPs and other health caregivers working in remote locations to manage their patients. In the Project ECHO model, specialists spending 1 hour collaborating with other PCPs can potentially lead to better management for hundreds of patients. The 4 principles of the ECHO model are amplification, for the use of technology to leverage scarce resources, best practices to reduce disparity, case-based learning to master complexity, and to capture the data monitoring outcomes to increase our impact. As of last year, over 4 million participants attended an ECHO session. There are now over 896 ECHO hubs and 33 super hubs. There are ECHO hubs spanning across 63 countries, and ECHO participants that reside or join in from almost 200 different countries. That's over 93% of our world's countries touched by ECHO today. And there are over 500 peer-reviewed publications. These numbers continue to grow each day with each and every ECHO session. I just got off one just before coming on stage. ECHO is connecting people worldwide to life-saving knowledge, enabling them to train and mentor hundreds of thousands of learners who create change in our rural and underserved communities. There are now over 6,000 plus ECHO programs in existence, with its global impact reaching as far as Africa, Latin America, Brazil, India, and now even Hawaii. In July of 2015, the Hawaii State Rural Health Association partnered with UH Manoa's JABSUM, the Hawaii Pacific Basin Area Health Education Center, or AHEC, Ohana Healthcare, and the State Department of Health's Office of Primary Care and Rural Health. We sent a team of 7 Hawaii stakeholders to the University of New Mexico to participate in Project ECHO's orientation and immersion training. And this team was charged with the task of planning and launching 2 of our pilot ECHO Hawaii clinics back in 2016. Hawaii Rural Health ECHO is now a replicating partner of Project ECHO. We offer behavioral health ECHO, geriatric ECHO, and pediatric ECHO. We link specialist teams at our hubs with care providers in our local communities of our island state. We aim to be a resource that delivers high-quality CME experiences that meet our needs, building capacity for improved patient care and to promote best practices. Here we have Behavioral Health ECHO. Now in our 8th running year, it was one of our pilot ECHO programs and still in existence. They meet every Tuesday at noon on Zoom from 12 to 1. Since the beginning of this pilot program, we have had since 360 clinic sessions and over 20,000 healthcare providers in attendance. Behavioral Health ECHO is accredited by Queens Medical Center for free CME and participation continuing ed unit credits, social work CEs from the National Association of Social Work, and ADA, the Department of Health's Alcohol and Drug Abuse Division, CSAC credits. Every month, we have sessions on adult behavioral health, pediatric behavioral health, community resources, and now opioid and substance use disorder sessions. Our pediatric echo is now in its 5th year. They meet every first and third Wednesday. Here we have our medical directors, Dr. Luker and Maxim. This program is accredited by HPH for CME credits, social work credits from ASWB, and also ADAD credits. In November of this year, we will kick off our 2nd Pediatric Mental Health Series in partnership with Department of Health for the Pediatric Mental Health Care Access Program. So that will run this November, December, and possibly through January. Some frequently asked questions. What is an echo session like? So tele-echo clinics are a 1-hour Zoom web conference, mostly on your lunch break. So you can have your camera off while you eat lunch, learn, and earn your credits. You guys will need to earn lots of credits for your licensure. It's a brief topic presentation with a mentor or specialist, followed by case presentations, review, group discussion. During the clinic, you and other participants are encouraged to present specialty patient cases and learn from feedback provided by mentors and your peers. Why should I participate? You have access to specialists and networking here in Hawaii who can assist you with specialty care, allowing you not only to care for your patients, but also enhance your own skills and knowledge. Participation in clinics are free, and there are no membership fees. You'll receive no-cost CME credit for the time you participate in each echo clinic. Do you need special equipment? No special equipment is needed, and you can participate from anywhere via Zoom with a PC, tablet, laptop, or your smartphone. At any time, you're welcome to present a case at any of our echo clinics, and some of our echo sessions, we offer gift cards if you present a case. We have forms that you can fill out, but also if on the spot you'd like to unmute yourself and present a case, you can do so as well. Behavioral Health Echo offers, I believe right now it's $150 for case presentation. What Hawaii Rural Health Echo does not, we do not provide direct patient care or telemedicine care. We do not promote commercial products or bill for any medical service. We do not charge providers to participate. What Rural Health Echo does is increase our health workforce capacity, decentralizes specialty knowledge, incorporates guided case-based learning, promotes best practices and measure outcomes, provides no-cost CME, and leverages our technology. We hope that you can join us on one of our Echo series here. And for more information, please visit us at www.hawaiiecho.info. And mahalo for your time. Any questions? No? Thanks for bearing with me.
Thank you again, Summer. And thank you again, Dan, for being here. Okay, we have our last, I still have the one last gift card. So I'm gonna bring up Kathy Moonshine. We will explore how the 6 pillars of lifestyle medicine support and improve the mental and physical health of our clients and ourselves. These pillars are sleeping, diet, exercise, stress management, social support, and limiting substances. Dr. Moonshine is a licensed clinical psychologist, certified substance abuse counselor, and lifestyle medicine professional. She works with patients in all the islands through her private practice, Moonshine Therapy and Consulting. She is an avid gardener and a mother of 5 French bulldogs, utilizing lifestyle medicine principles to improve health and wellness. So let's give a big round of applause for Kathy Moonshine.
All right, it's great to be here. I am a psychologist and a substance abuse counselor. I have an office-based practice in Hilo, but also do telehealth about 60% of the time, and I primarily take referrals from the neighbor islands and try to refer people back on Oahu to providers that are there. Because the reality is that life on each of the islands is different, right? I've lived on Maui, I've spent some time here in Kauai, I've spent a little bit of time on Molokai, and then about 5 years on Big Island, mostly on the east side. And every community is different. When I first got here, it was during I was on Maui practicing in the 2018 lava flow eruption that took out a lot of Leilani estates, and I had many clients that came to Maui because they had family there, right? They needed to leave, and they came to Maui and they said, oh my God, this is a big city, I need to get back to the country. And they had a really hard time adjusting, right? And so every place is different, so it's really helpful for us to think about that. And so one of the roles that I play, in addition to my clinical work, is that I am the Director of Advancement of Rural Behavioral Health for the State Rural Health Association. So I work with Summer and Dan and Lisa Rentz and Jana. And at the end, I want to ask Jana to come up and talk a little bit about how we're using some of our federal grant funding here on Kauai to support your community and being healthy. So I'm really passionate about that. I'm passionate about this idea of lifestyle medicine, which I'm also certified in. And this is a multifaceted framework that we can use, those of us that are providers in the room and paraprofessionals, that we can use ourselves as part of our own wellness protocols and avoiding burnout. And we can also use this with the community members that we're working in whatever your role is. So how a physician might use lifestyle medicine, how I, as a behavioral health provider, might use lifestyle medicine may look different than how you would use it, and yet it's pretty straightforward, and there are pieces here that we can all use and probably do already use. So lifestyle medicine is a particular specialty, and there is a professional organization for it. And so what lifestyle medicine looks at is how do we treat chronic illnesses, both mental health, substance use, and medical, physical health illnesses in a way that may include medication, but to try to minimize that or eradicate the disease if we can. And so many chronic diseases like hypertension, diabetes, obesity, cardiovascular disease, which are prevalent in our communities and often prevalent with communities of color, impoverished communities, rural communities, is that we could really do more and we could reduce these diseases if we are doing more physical exercise, being thoughtful about our diet, getting a healthy amount of sleep. And so that's really at the core of lifestyle medicine. So there are many different people that work on the lifestyle medicine team. Sometimes it's a collaborative team. So I previously was the behavioral health director at the family medicine residency at Hilo Medical Center. We have one of our residents here who is graduating, Dr. Chung, and he's here doing a rotation with Dr. Chilius, who we love always sending our residents here and having the residents have the experience here in Kauai. Because again, your community is different than the other communities. So that is a lifestyle medicine program where that primary care system is really looking at how do we continue to prescribe medication for chronic diseases, but how do we also do things differently and how we live our lives to be healthier, and then maybe some of those chronic diseases are less or go away and then we don't need the medications as much. And so lifestyle medicine professionals work on health promotion and making lifestyle changes so that we are physically and psychologically well, right? So lifestyle medicine is a medical specialty that uses interventions that are primarily focused on changing how we live our lives, and it specifically focuses on the chronic health conditions, the physical health, but there's also a focus of how do we take care of ourselves with our psychological health and substance abuse problems if they're there, because it's all related, right? Like when I first got in the field, we used to believe that mental health was one set of problems and people had those problems. People had addictions issues, but they didn't have mental health problems. And we had these silo systems. And then we had physical health saying, I only deal with physical health. I'm not going to deal with those other things. Well, what we realize now is that we are, in fact, all one person. And we all have our versions of what's going on with our physical health, good and bad, what's going on with our emotional health, and what's going on with potentially problematic substances. And so the 6 pillars of lifestyle medicine, which we're going to spend some time on today, is really looking at how do we live our lives in a way that's healthy. And so the sort of gold standard of lifestyle medicine is a whole food plant-based diet. Some people, they're all in on that. Fabulous if that works for you, if that works with the people you're working with, great. If that is not your gig or it is not the patient's or client's thing that they want to do, there are other ways to do this. There are many versions of how we can be healthy using this framework of lifestyle medicine. So the gold standard is whole food plant-based diet, physical activity, restorative sleep, stress management, avoiding risky substances, which can also be social media, positive social connections that hopefully effectively reduce and prevent chronic diseases. Oops. So this is the graphic that we use for lifestyle medicine. These are the 6 pillars. So starting at the top, if we're looking at clock, physical activity, and I'm going to go through each of these and talk about gold standard recommendations and more low-key recommendations. So physical activity, managing stress, healthy relationships, sleep, which is super important in my opinion, avoiding risky substances, and healthy eating. So thinking about how behavioral health and mental health and substance abuse counselors may use a lifestyle medicine framework is that we're going to look at the biopsychosocial factors that are contributing. And so that may be what is, the brain chemistry that someone may have that leads them to have an addiction or have a mental health disorder, or what are the issues that they're dealing with their physical health, if that's chronic pain, or other things that are making their mental health worse. One thing we know that after people have major surgery, particularly heart surgery, is that they often feel depressed, right? Because they've had the impact of anesthesia, they've gone through the process of having the surgery, and then they often have a little bit of reduction of the amount of oxygen that they're getting, and their sleep is impacted. Not surprisingly, people feel depressed, right? And so a mental health professional is hopefully looking at that all of these things, the biological components, the social components, and the psychological pieces, and how that all creates both what's going well in a person's life and what's not going well in that. And hopefully as a mental health professional, and this is not how I was trained, as I like to say, in the 1900s, so I was trained about 50 years ago, well, maybe not quite, maybe 30 years ago I was trained. And at that time, mental health professionals weren't thinking about substance use, we weren't thinking about physical health, and we were really looking mostly at social causes, like what was impacting the person's mental health based on their relationships, their early childhood experiences, but now what we know is that it's all related. And so we need to be thinking about what is going on with someone's physical health. And doctors are now being trained, and nurses and everyone else a little bit, but we can do a lot more of this, being trained in considering what is going on with the person's mental health, with their potentially problematic substances, and what is happening with their social environment. Are they living in poverty? Do they have intergenerational trauma? All of those things. So hopefully, as a healthcare field, we're starting to think more and more about this. Another thing that we do a lot of is motivation, is helping people be healthier, taking care of their physical health, their emotional health, and managing their addictions, if they have them, in a better way. So one of the things we do is encourage deep breathing, and this seems really simple. But taking slow, deep breaths helps us be grounded, and it down-regulates our nervous system. So it reduces a lot of the anxiety that we have. It helps us be a little bit more clear-headed. It helps us be more responsive in making choices and how we live our life. So it's a very simple thing to breathe deeply, and often we don't give it its due. Hydrating, so breathing deeply, hydrating often, eating well, moving regularly, sleeping effectively, laughing. Laughing is a great stress reliever, and it's also an opportunity to take a deep breath. So laughing at ourselves, not taking ourselves too seriously, laughing at the absurdity of the world goes a long way, right? And there's this old phrase, saying about laughter is the best medicine, right? So decades ago, maybe a century ago, in medicine, when people were dealing with chronic pain and chronic diseases, we tried to get them to laugh because we knew that that had a positive benefit. So I think we can often laugh more, making meaningful connections and limiting substances. And so hopefully mental health professionals are moving more towards looking at overall health, not just psychological health. And one of the things that we do to help people make changes in their life and improve their lifestyle habits are called the 5 A's. And so it's assess, assess, advise, agree, assist, and arrange. So as assessing is working with the client or the patient around what's going on, what's working well for them, and what are the challenges, what are the problems, and what do we want to address? Is it that we want to help them work on a physical health issue like their diabetes or their chronic pain? Is it that we want to work on some anxiety, depression, some family relationship struggles? Is it that they're drinking too much? Is it that they're putting themselves at risk with other substances and maybe, not having good substances and having an overdose potential or something, or are they taking chronic pain medications and have become physically dependent on them and need some help with that, right? So what is it? And it doesn't have to be, maybe it's one thing, maybe it's a couple things, hopefully it's not too many at once. And then from there, we want to advise. We want to give some amount of education. We want to normalize the experience. So for people with addictions issues, helping them understand that it is not a disease of willpower. If they could just say no and use moderately or stop having the problems, they would have already solved that. That the current thinking is that addiction is in fact a brain disease, and it does have to do with their brain chemistry. Very similar with many of the mental health diagnoses, schizophrenia, bipolar. Those are very much biologically based brain diseases. It is not that that person is a bad person or that they deserve it or that they're weak, right? So we're going to do some education around that. We're also going to do some education about how, like the idea of quitting smoking, if you replace that with exercise, that can be a really successful way to do that. So that how the impact that physical movement has on our mental health. There's a lot of data to support that cardio exercise, getting our heart rate up, has lots of antidepressant qualities without the side effect of psychiatric meds. Now, people need psychiatric meds and they use them appropriately. I'm a fan of that too. And exercise is a great thing to do. So we're going to assess the problem with the patient collaboratively. We're going to advise them and give them some education. We're also going to reinforce what they already know. And then hopefully we're going to agree on a plan. What makes sense for you? If you want to be healthier in these ways, what kind of strategies do you want to use? And of those 6 pillars, what's going to be most useful for you? And sometimes I have at least 2 different strategies with this, is that I will go with what they're already doing a little bit of and try and encourage them to do more of that, so build on the strengths they have, or go for what's maybe the hardest thing and have them jump in the deep end and be successful with that, and then they can go to the easier things pretty quickly. And it depends on the patient, depends on what they want to do and where I think their abilities are for that. So we're going to agree on a plan. I'm going to assist them with that plan. How are they going to make some of these changes? How are they going to start doing some of the things that we're talking about? And as we're assisting on the plan, I often talk about what are the barriers. What's going to get in the way? How is this going to be hard? Why do you not want to do it? What are your family and friends going to say about it, right? Those kinds of things. And so we want to talk about that and problem solve some of those. And then we're going to arrange for some amount of follow-up. So having the patient come back in and talk about how that's going. In the beginning, I usually follow up with people every couple weeks. If things are going well and they're stabilizing, then I might spread that out to every month. Now, when I did this working in a primary care office, often people see their primary care doctor every 3 to 6 months. And so the doctor may be having the same conversation, but they're not able to see the patient again. Also, the physician usually sees patients for 15-ish minutes. I get to see people for 45 minutes to an hour. So having behavioral health embedded in primary care, on community health teams, outreach teams, street medicine, is a great way to follow this through. This is a framework all of you can use in whatever role you have, even with your family and friends, even with yourself. If you're working on doing something different and making changes with someone or with yourself, you can assess, what is it that I want to do differently? What is the information I need to be able to make informed decisions about that? Agree with yourself, with someone else. If it's your own change, agree with the person you're working with. What are the changes to be made? Assist them, or for yourself, ask for assistance. And then arrange follow-up, checking in about how's that going. All right, so lifestyle medicine, the things that we recommend for patients to work on. These are the 6 pillars: diet, exercise and movement, sleep, stress management, connections. And connections can be connections with other people. It's also connections to ourselves, right? It can be connections to nature, to pets, to a higher power or the spirit if that fits for someone. So connections can be very flexible. And then reducing substances, and I have thoughts about this. I work both from an abstinence-based perspective and a moderation management perspective. And it depends on what's in the person's best interest. If the individual has an out-of-control addiction that they cannot use moderately, and I'm not judging them, and it's not about their willpower, it's not about them being a bad person. If they do not have the ability to use moderately, then abstinence may be the best option. If they do have the ability to use moderately, depending on what the substance is, and that's my decision, well, I get to use my clinical expertise with them to decide that when someone says, oh, I don't really have a problem, maybe that's accurate, maybe it's not. If I'm going to work with them on moderation management, that also depends on what are the substances, who else is around, or what are their responsibilities, that kind of thing. But both of those are evidence-based practices that can be useful. All right, so for diet, the gold standard from lifestyle medicine is a whole food plant-based diet. There is a ton of research about being vegan and eating non-processed food. So it is possible to be vegan or vegetarian and eat a lot of processed foods, right? That's not really what we're talking about here. That may be better than red meat, but maybe not, because the processed foods have an enormous amount of salt and other chemicals, right? The gold standard would be whole food plant-based diet. If that fits for you and the people you're supporting, fabulous. If that is not the thing, and there's a lot of reasons why that is not the thing, that's not always easy to do on a limited income. It may not resonate with someone culturally to eat a whole food plant-based diet, that's fine. Then sort of lower standard, or the more low-key way to go about it, is to eat fresh and less processed, right? So one of the things we encourage people to do is read food labels and to look at sodium content. It's pretty amazing, right? Here in our history of Hawaii, right, Spam is a big deal. Look at the sodium content in Spam. And I'm not saying don't ever eat Spam. Maybe don't eat it every day, don't eat it at every meal. Now, the processed foods came around in the 50s and 60s, and they were groundbreaking. Some of us remember that, with TV dinners and stuff. They're enormously convenient. And here in Hawaii, the processed foods were really helpful for us to have, food when we really needed it, after we sort of got away from farming the lands as much as used to happen. And so things like Spam and other things in the middle of the war was really, really helpful. And military has used the processed foods in ways that is really helpful that you can't get to a grocery store. And yet they're not always healthy, and if we're eating a lot of them every day. So if you pick up a can, look at the sodium level, and you want to look at the serving size, the calories in the serving size, and compare that. And you want it to be equivalent or less. So if you look at a can of soup, soup sounds like it's healthy, right? And in some ways it is. Soup tends to have a lot of salt. A serving of soup, a can of soup that's one serving, may be 200, 250 calories. The sodium is 1,000 milligrams. Really, we prefer it to be closer to 200, right? If you're dealing with someone with anxiety and high blood pressure, that sodium's not doing them a lot of good. If they have heart issues, that's not doing them a lot of good, right? Another thing to think about from a mental health perspective, someone with anxiety, smoking cigarettes and drinking caffeine doesn't help their anxiety, right? I have a patient who's like, oh, I'm anxious all the time, I can't sit still. But they drink 4 or 5 of like the Monsters every day. They're like, well, I can't function, I'm so tired. I'm like, well, you're probably not sleeping at night, and you're jacked up. Of course you're gonna feel anxious and like you're vibrating, who wouldn't, right? So eating fresher when we can, and it's about balance, right? Some of the processed foods is just part of our life, we're gonna do it. But try to eat fresh when you can. And one of the recommendations we make when you go into the grocery store is to buy things in the outer aisles. Most of the stuff in the center of the grocery stores are processed. If it comes in a bag, a can, well, if it comes in a can or a box, it is probably processed. Fresh vegetables in a bag, those are pretty good. Other things in the freezer aisle, not so good, right? So just think about that. Try to eat fresher when you can, have a little bit of balance. Exercise. The gold standard for exercise from lifestyle medicine's perspective is 150 minutes of moderate exercise a week. That's 30 minutes 5 times a day, 5 times a week, 5 times a day. Okay, fabulous. I'm not doing this. I have. There are times in my life when I've been able to do it. I'm not currently making it happen. But it can be really helpful. If that fits for you, great. If it fits for your patients, there's lots of reasons why this doesn't work, right? They don't have access. Gyms are super expensive here for sure, right? They don't have time. The weather doesn't cooperate. They're not always in a safe neighborhood where they can get out and move. Okay, that's all right. Let's at least work on reducing sedentary, sitting still, right? The recommendation here is that we get up and stand up, and we haven't, and I have not done this all day today, is that we don't sit for long stretches. And so that every 20 minutes we get up and stand up for 2 minutes, and we stand or move or touch our toes, great, any of that's good, or 5 minutes once an hour. So one of the things I say to folks that are watching, that sit and watch TV, and I do it too, so I'm not judging in any way, is that at commercial breaks or between shows, you get up and you move. You get up and you stand up and you stretch and you take a deep breath, you go to the bathroom, you touch your toes, you go outside, look at the moon, whatever it is, that we just don't sit for long periods of time, right? And then another thing that we say from lifestyle medicine's perspective is any movement is good movement. Right? So anything you do to move for 3 minutes, 5 minutes, 10 minutes, anything that the patient can do within any limitations they may have. And it's kind of paradoxical, and I struggle with my own chronic pain, is that it feels like often for people with chronic pain, including myself, is that moving makes it worse. And it does in some ways, but if we move more, we're more flexible, we keep our muscle mass, and that's actually better for reducing the chronic pain. Of course, we have to do that in a way in whatever makes sense the person has a disability or limitation. Sleep. Sleep is something we really, really, really underestimate the importance of in our society. There's a great TED Talk about this called Sleep is Our Superpower. Neuropsychologist at UC Berkeley talks about how we do not get enough sleep and we cannot make up the sleep we lost. So if you don't sleep well for a week or two, sleeping on the weekends is helpful, doesn't actually replace the sleep you left. So if you're not sleeping well, try to sleep better. Try to help the people that you work with and that you support in your life sleep better. Ideally, we're getting on average 7 hours a night of sleep. People say I only need 4. It's not true. The research shows that people are underreporting how much sleep and that the impact that not enough sleep has, we don't really track that. People are like, no, I'm fine. I function just as well when I'm sleep deprived. It's not true when they've done research. Being sleep deprived is almost as bad as driving drunk on some performance issues. So, depending on the level of sleep deprivation and those kinds of things. So, however, not everyone's life allows for them to get 7 hours. If you are houseless and living on the streets, that may not be an option. If you are working multiple jobs, if you have kids, whatever it is, get the best sleep you can get, right? Make the quality sleep happen. And one of the rules, thinking about one screen and limiting social media, is that a recommendation that we make is no screens during the time we should be sleeping. It is so easy, and I struggle with this, and even last night, I wanted to pick up my phone, and most of the time I can avoid doing it. Picking up our phone in the middle of the night wakes our brain up. Even if it's great if you have the nighttime setting on the light on the phone, that helps. But any light in our eyes, even turning our light on in the bathroom in the middle of the night, drops our melatonin levels and wakes us up, right? Before we had houses to live in and we had electricity, and we were those people, our melatonin levels regulated to the sun. And so melatonin levels is the sleep hormone. It helps us sleep at night. When the sun comes up, our melatonin levels come down. When we got modern society, we moved inside and we got these lights and TVs and phones and computers and other things. That has the same effect the sun has on our melatonin levels. Picking up our phones drops our melatonin levels. And then we interact with the phone. We scroll, we think about it, we write a comment, we read a comment, we get annoyed about something, we laugh about something. That all wakes our brain up. So one thing, maybe, that's good for people to do, people don't always love this recommendation when I make it, is no phones during sleep hours, right? It just really helps. Watching TV, a little bit better because it's across the room, not right in our face, and we're not interacting with the TV in the same way we interact with our phone. Alternatively, from a sleep hygiene perspective, reading, doing crafts, that kind of stuff is great to do if you can't sleep, not so much the light things. Stress. Increasing our stress management and coping skills, right? Doing the best we can with that, knowing that's imperfect and there are lots of things that are out of our control. And then some specific recommendations, and there's lots of ways to do these things, and it just depends on who you are and what fits for you and the people that you support, is practicing some amount of mindfulness. And mindfulness can be formal meditation. If that's what you want to do, great. It's not my thing. It can be connected to a religious spiritual framework, perfect, and it doesn't have to be. Mindfulness is just being present in the here and now and not getting too wrapped up in the past or worrying too much about the future. It's about being here now. And there's apps out there, there's things you can read about. Having gratitude every day goes a long way to supporting our mental health and our physical health. And then finding meaning in our life, having a purpose, having some, reason and values. Connections. So I think I already said this, but being connected with ourselves, family, friends, pets, nature, and perhaps the spirit. And then the last thing is reducing substances or having substances in our life in a way that's healthy. So some people have issues with this, other people don't, and that's okay, good for them. But when I think about substances, I think about sugar, caffeine, and nicotine in addition to alcohol and drugs, right? And so all of the sugar that some of us consume isn't always our friend, and moderation might be better. Thinking about how much caffeine we intake on a daily basis, is that really helpful? Maybe, maybe not. And then nicotine, right? Those kinds of things. So those are the 6 pillars. I'll go back up. I should have had one. And so things to think about. Now, are you going to work on all 6 of these? Probably not. Again, you can start with what's the easiest thing. So if someone's already being healthy with their diet or they're doing really well with their sleep but could use a little improvement, maybe that's what you encourage them to do more of. Or if there's one that they're really not doing well with at all and they're going to get a big payoff from that one, like stress management, then that's the first thing I'm going to start with. So it just depends on where the person's at and what I think makes sense to them. This is a similar resource. It's not lifestyle medicine specifically, but it's in the same vein. So this is Change That Matters, and it's, do you remember, Dr. Chong, UMN? It's not New Mexico, but I forget which educational institution. Go to the website. They have, and this is all public domain stuff, they have 10 worksheets there, and they have them in Spanish and English. I don't know if they've added other languages since I was last on there. But these are the five of them. And they're little pamphlets. You can print them out in color or in black and white. And they fold up, and they're a little sort of recommendation about what to do, how to be physically active, and then there's a space for the person to write in what they want to do. And the research really shows that when we write down our plans, we are a lot more likely to do them. And then if we share those plans with someone, whether that be us, a family member, a friend, post it online, right, that also helps. So having a structure and then taking this home and putting it on their refrigerator, keeping it in their drawer, having it on their bathroom mirror, that goes a long way to people doing it. So this is a great resource. It's called changethatmatters.umn.edu. All right. So things that help us when we are doing some of these lifestyle medicine things in our lives, both us and the folks that we support, is that, hopefully we're going to personalize them. So for me to say to everyone, hey, go exercise 150 minutes a week. Okay, some of you already do that. Fabulous, good for you. Some of you are like, okay, yeah, I'm going to get back to doing that. And some of us are like, oh, it's really not going to fit in my life. Forget that, right? And as soon as I do that, if I talk to someone and say, hey, go do this, and I don't get who they are and what's important to them and how that fits, I'm going to lose them. So let's personalize it and individualize it. When we're using lifestyle medicine, it reduces the risks of serious medical events and other complications like stroke, heart attack. It increases our life expectancy. It helps us get to a healthier weight. It improves our energy and stamina. It can reduce a lot of the GI discomfort that some of us feel. And it also, there's a lot of research support that using any of these parts or using the lifestyle medicine framework reduces many of the significant cancers. We will need less medicine if we are using a lifestyle medicine framework in our life. There's lots of financial benefits, right? If we stop spending money on some of the unhealthy things, me, Starbucks, then I'd have more money, right? We're going to have to go to the hospital less often. We're not going to have to see our doctor as much. And so there's a graphic here that may not be easy to see, but on the left-hand side we have in the green lifestyle medicine, and it says it's low risk, low cost, and sort of naturally occurring things that we can do. And then going to the other side, the extreme end is in red, and that's surgery. And that's high cost, both in terms of the medical procedures, time away from work, potential disability, all of those things. And so from a lifestyle medicine perspective, we see that as being healthier for all of us and our friends and family, but also healthier for our communities and more economical. Ultimately, it improves the mood, mind-body connection. So this is a graphic I like to share. It's called the Mental Health All-Stars. And if you search online, it's a public domain image, you can find it. These are all the things that we know are good for our mental health, and there's most of the lifestyle medicine things are up here. So this is a handout I share with. So I'll just read it to you because I'm sure you can't see it in the back of the room. Routine, having a routine in our lives. Sleep. Sleep is super, super, super important. And the first thing I work on with my patients is, are they getting a healthy amount of sleep? Should we be improving that? Now, there's only so much we can do. You have insomnia, you have other things, but what can we do to have quality sleep? The third one is creative outlets, social activities. I'm going to walk in front and I'll just yell. Healthy diet and love. Love would be connections. It could be romantic, intimate love. It doesn't have to be. Meditation is down here. Humor, having a sense of humor and laughing. Sun and air. That's something that we have access to almost every day of the year. That is not true in Minnesota, right? It's just not. I moved here from Portland, and it's gray, literally gray 6 months of the year. You do not see blue sky. It rains more in Hilo than it rained when I lived in Portland, but at least we get blue sky, right? It's heavier rain. And then there's therapy and exercise. So these are all things that help us with our mental health. Not that you do all of them, not that the people you support do all of them, but the more we do of them, the better off we're going to be. So I encourage you to think about that. Okay, last few slides. This is a simplification, and I could work on this for weeks or months with patients, but these are just sort of how I would triage depending what the patient is working on or what their priorities are. If someone's presenting with more anxiety, the first thing I'm going to work on with them is stress management. And I'm going to help them with deep breathing, what's going to downregulate their nervous system and help them. The anxiety may not go away, but hopefully it's more manageable. We're going to work on gratitude, positive self-talk, and avoiding the avoiding. So when we have anxiety and something is making us nervous, then we try to not do it, and we feel better, right? Except the next time you have to do that thing, you don't want to do it, and you avoid it again, and you avoid it again. And the more you avoid, the more you don't want to do it. So we actually recommend that we lean into the anxiety and fears and do it anyway, at least a little bit. The next thing I'm going to work on with someone who has a lot of anxiety is sleep, helping them sleep better. Exercise can burn off a lot of the nervous energy and will help them sleep better. I'm going to look at diet, specifically at the things that are stimulating them, caffeine, sugar, and other activating foods, and we can always drink more water. Connections, staying connected to themselves, and how does that, and their family, friends, their pets, how does that help them be grounded and manage their anxiety? And then less drugs and alcohol, maybe none, depending on who they are. Depression, slightly different. So anxiety, I start with stress and then I go to sleep. Here with depression, now this isn't always the case, but this is sort of typical. I'm going to start with exercise. Exercise has a huge antidepressant quality to it. Then I go to stress management, sleep, want to avoid over and undersleeping with depression. And that's a process we work towards, not sleeping during the day, not sleeping more than 8-9 hours. Diet, trying to reduce the comfort foods. They feel great, they don't help the depression. Connections, and then again, substances. Alcohol makes it worse, feels like it's a coping strategy. Alcohol is a physiological depressant, only makes the depression more depressed. All right, and then this is the last diagnosis, bipolar. Sleep. consistent sleep, going to bed at the same time, getting up at around the same time, really, really helpful. Now, bipolar does tend to be more biological in nature than some of the other mental health issues, so that is also important, and I'm not a prescriber. But sleep, staying consistent with their sleep, and when their sleep gets off, then that may be an indication that they're ramping up into hypomania or ramping down into depression, and so I pay attention to how they're doing with sleep. Stress management, a lot of coping skills, managing impulsivity, and this one is helpful. Exercise, diet, right? Substances, more than 50% of people with bipolar self-medicate to manage their moods. Now, most people with bipolar, and we would probably feel this way too, that if we felt a little up and were happy and had a lot of energy, we would like that. So people with bipolar tend to use stimulants to keep the hypomania going, mania going, and then they use things like alcohol or marijuana to cope with the downside of depression. Again, the alcohol is going to make the depression worse. Also, alcohol seriously disrupts our ability to get quality sleep. So alcohol does not help us sleep better. People think it does not. All right, the last thing I want to say, that's lifestyle medicine. I just want to give a plug for HawaiiUtelehealth.org. This is funded through the Hawaii State Rural Health Association and hosted at the University of Hawaii. This is free telehealth services. Mostly at this time, it is therapy. We have a little bit of psychiatric prescribing. In the past, we've had primary care. We may get back to having primary care. This says we have primary care, we don't. But people can call and talk with a coordinator and get connected with a therapist. We have 6 or 7 therapists across the state right now. I'm one of the providers. And then we've just onboarded another 6 or 7. Some of them are Kaua'i providers. This was a project that started out of COVID because, of course, office-based practice wasn't working. This is a great resource to get people into behavioral health services. We are also going to do another round of recruitment, hopefully get more psychiatric prescribers and a few more therapists on board. It is not a perfect resource, but it is something. Not everyone loves telehealth, I'll get you. Not everyone loves telehealth, and that's okay. But the people who want to do telehealth, it is a fabulous option. I have several clients on Molokai, well, I have a couple people on Molokai, a few people on Lanai. I have several Kauai clients that would not go to an office here for therapy, right? Because someone will see it and someone will know, right? And that's a little bit true on the Big Island, but we're a little bit more spread out. It's not as true on Maui. It's for sure, might be true in some small places on Oahu. But other things is it's just convenient. You don't have to drive somewhere. You don't have to deal with parking, right? And we have options, and Jana's going to come up and talk about if people don't have the hardware to get online, we can help with that. So it's not a perfect option, may not be the therapist they necessarily want, they might not like it, that's okay. But the people who will do telehealth, who do teletherapy, you do not need to have insurance for this. We will see everyone. If they have insurance, we'll also bill that too. But it's just one more resource for you, and hopefully we will continue to expand our panel and have more and more people. All right, let me see if there are any questions about lifestyle medicine, and then I'll have Jana come up and talk about some of the funding we're investing in Kaua'i. Yes?
On the, what is the wait time for someone?
I actually don't know that off the top of my head. I will tell you that, and this is how I run my practice, is if I get a referral from Hawaii to telehealth, I reach out to them that day, and they have the option, depending on if it fits in their schedule, to get an appointment within 3 days. Generally, we try and get people in within 2 weeks. Because the reality is that if people wait more than 2 weeks for a therapy session, they drop off. Right? And so I can't tell you that all the providers do that, but I think we're all pretty committed to getting people in within a few days to a week or 2. Right? We don't run a wait list. If we get to that point, then we're going to refer people on to another resource because that just doesn't work. Any other questions about my stuff? All right. Jana, you want to come up and talk a little bit about our investments?
Thank you all. My name is Jana Ortiz-Miziazik. I too am with Hawaii State Rural Health Association. I just want to first say thank you. This has been a great opportunity for us to be here. I am from the Big Island, so I'm in Pono on the Hilo side. And so for us, we've been able to work on Kaua'i virtually. So I'm so excited. Been able to work with Dr. Chilias through KCCC on their MOUD-MAT, so medication for opioid use disorder, substance use. And so what we're trying to do really is look at how can we work within community and what needs do you have. The programs and grant funding that we do have is focused around mental health and substance use disorder. But as a whole, for Hawaii State Rural Health Association, we really are looking at how do we work in a way that works for you. So Summer talked about Project ECHO, and one of the focus areas is behavioral health. What we've also integrated within that is medication for opioid use disorder and generally substances. And so I encourage you all to participate. It's free continuing education. It's an opportunity to connect our rural communities together is our big piece. How do we connect and bridge together rural communities here on Kaua'i, but how about Moloka'i if we're on Big Island? Because I think within our communities, we have some great, unique strengths, and we also have different challenges. There are some commonalities that we can learn from each other, and that's where we hope to be and where we hope to be able to provide some lift at times, and then to be able to make those connections as well. Currently, we've been working with Alice Luck, and so we're hoping to do seeking safety trainings. It is a virtual online training at no cost. So if you are interested, please reach out to Alice. It's something that we want to be able to encourage for any providers, but you don't have to be a provider as well. So that's the beautiful thing. So please reach out to Alice just to make sure that you guys, if you're interested in doing it, we want to encourage that. It's been an exciting opportunity for us. We've worked with Keala Foundation as well, so on some of the youth prevention for high-risk youth. But we also really are looking to, within our programs, on resiliency, so mental health resiliency. How can we provide that here, or how can we work with an organization here that is doing a great job and we can add some lift or some support in those ways? So if you guys have any questions for us, please let us know. Our real overall goal is about collaboration, listening, and then looking at how do we work better together and how do we really build those bridges across the state. Oahu is great. We all know this to a certain extent, but the real things, I think, our real life happens here on the neighbor islands. So how do we bring those commonalities together? How do we bring those pieces so that we can advocate together? How can we bring some of this education to Oahu to say, hey, here's an issue. Transportation looks different on the Big Island than it does here, but it's still an issue, right? Same thing on Maui. So how do we bridge these pieces? Housing is gonna look different. Everything is expensive, but what does that look like? So we really wanna be able to hear from you all as organizations and individuals, and then how do we make the little that we have at times more, right? Because we're all working very creatively. So if you do have questions for Project ECHO, please reach out to Summer. She's been great on coordinating and pulling everything together. If you have questions for us in general, you can talk to Dan, myself, or Dr. Moonshine. So we really appreciate it. If you have any other questions, you can randomly snatch us. We'll be here for today and tomorrow. Any questions? All right, thank you. Oh, yes.
Oh, right.
Thank you. So we've been partnering with Kaua'i Rural Health Association, and within one of our programs, we do computer literacy. And so Ray has been really great about being able to coordinate and organize. So this is computer literacy, not 101, but like 0.001. Okay? So many times it is working with our kupuna, our seniors, on how to turn on a computer, the laptop, and pulling those pieces together, because we know from a telehealth standpoint and a technology standpoint, our kupuna at times are left behind. So if transportation is an issue for them, because they need to coordinate ride, they need to do X, Y, and Z, if they had a laptop at home, technology at home, they could potentially have some telehealth visits with their primary care provider. So the program that we are doing is being able to provide trainings here on island. Ray's been doing really great with that. If they go through the whole training, they are given a laptop. It's a refurbished laptop, and it will do the basic things that they need. And what the training will go through is, like I said, the .001 turn on laptop, connect to internet. But the other piece that's really important is many times they need to have email. So what the heck is email? We know what email is, but for some individuals, they don't even know what the value of an email is. For many of these different platforms, you need to have an email account to set up your account. So they go through that process as well. And it is at no cost for anyone who attends. I'll say on Hawaii Island, what we've been able to do is hook it in with one of our substance use treatment facilities, but counseling centers. And so as individuals are in their outpatient treatment, if they're interested and they need other additional services, we've done a training with that small group, so that way they can get connected online. We've had individuals that said, you know what, I'm in my 30s and 40s, but I haven't really used technology and I'm ashamed to ask. So when we went into that group, they were able to get a laptop, they were able to get an email address, and they felt more connected and not less out of loop, and it reduced that stigma around just trying to get access to treatment. But then also being able to say, oh, I have a laptop, oh, I know how to get online now. So thank you for reminding me.
And let me add to that, also there's options for hotspots. Now, all of these resources, they're not designed, we're being really thoughtful, so we're not giving away $1,000 technology things that are just gonna get resold. They're very low budget, basic things. So the classes are great, but if someone needs help with telehealth, if they enroll in telehealth services, they can talk with Rachel, the coordinator, and I believe we have a community health worker here, I know we do on Big Island and on Maui, that can come out and set someone up, or meet with them in the community and set them up with a very basic used laptop and a hotspot. So again, if you have someone who's houseless, someone who doesn't have regular internet for a variety of reasons, then they can get that and then hopefully connect with us for telehealth. So there's both the option for classes, or if people don't need the technology education and are going to use the telehealth services. So it's not just for anyone, but if they need to get it to get to the therapy sessions, then we can help them.
Yeah, so just FYI, the next computer class on Kaua'i is on June 15th.
June 15th.
June 15th, next computer class.
So we have two classes, one in the morning from 9 to 12 and one from 1 to 4. And we're holding it at the Commitment Schools Community Hall in Yehui.
Did you guys get that? Yes, contact Ray.
Somebody that might be able to benefit from, getting a laptop. It just, a lot of people, like Johnny guys said, they're just afraid of the technology. They really are. I'm afraid of the technology too, but.
Yeah, me too sometimes.
How long are those classes?
3 hours. So
One class?
Yeah, from 9 to 12. And then when they finish the class, they get we've been giving away Chromebooks actually, refurbished Chromebooks, and they say that the Chromebooks are probably for the beginner, probably the easiest operating system to learn. So anyway, so just want to put it out there that June 15th is the next class. I've been busy with the conference, so I haven't really told anybody, so there's still a lot of space left.
See, this is your guys' opportunity. So refer patients, clients, family, friends, aunties, uncles. It's a great opportunity to be able to bridge those pieces together. Thank you.